I want to thank everybody for joining us here this afternoon. My name is Adrienne Bridenstine. I'm the Vice President of Policy and Communications at Behavioral Health System Baltimore. I'm here joined by a number of advocates who are we're here to raise the alarm around cuts coming to behavioral health, but I wanted to just mention a few people today. First, I want to thank Senator Heselman, who is not able to join us today. She is busy on the floor, but she is an important advocate for us in trying to help restore the cuts to behavioral health for this year's budget. Also want to acknowledge Delegate Jessica Feldmark, who we're going to hear from in a moment. But we're joined here today by the Mental Health Association, the Horizon Foundation, the Community Behavioral Health Association, and many other members of the Maryland Behavioral Health Coalition and the Maryland 988 campaign. These are statewide advocacy groups who have been working to help restore these cuts to the budget in FY26. You see here, this is what we need to do. We need to make sure everyone is aware that there is over $116 million in proposed cuts in this year's budget, and this is going to harm the mental health and well-being of our communities. The need for behavioral health is greater than ever. 1 in 4 adults experience a mental illness. 18% of Maryland high school students have seriously considered suicide within the past year, and we know that is rising. We hear stories about that every day, many of you who cover them. Black children are 2 times more likely to die by suicide than their peers. And even the Surgeon General issued an advisory over this fall that parental stress is an urgent public health issue. So we need to be paying attention to this, and we need to restore these cuts. If we don't act, these reductions are going to be painful. There will be no one to answer the calls for the 988 helpline, which means wait times will increase. It will harm trust in the helpline at a time when calls have been increasing. Mental health supports for kids will also go away. And the advocates have been working for decades to get funding needed to help put these services in schools for our children. There will be no place for them to turn for help. This will mean that more people will show up in our emergency departments and other urgent care settings. And we know that Maryland's EDs have some of the highest wait times in the country. So we need to raise the alarm about this, and we need to be paying attention to it. At this time, I'd like to turn it over to Delegate Feldmark for some opening remarks.
Thank you so much. Good afternoon, everyone. I'm Delegate Jessica Feldmark. I represent District 12A in Howard County, and I am proud to be the House sponsor of legislation to extend funding for our Behavioral Health Crisis Response Grants program this year. I was also proud to sponsor legislation last year to provide dedicated funding for 988. And I'm compelled to work on these issues because of my values, because of the need in our community, because of the needs that I hear from our constituents, parents who are concerned about their children who are struggling, parents who are looking for help themselves. This is a crisis. And it's one that we have to take seriously and that we have to fund responsibly. I believe in leading with compassion, but even if the compassion argument is not compelling to you, there's an important fiscal argument here, in that these cuts do not save us money. They end up costing us more, right? They end up costing us more in emergency room expenses. They end up costing us more in law enforcement expenses. They end up costing us more with more involved prolonged treatment if people can't get the help they need at the right time. And so, to me, this is just a really important issue, both from a values perspective and from a fiscal responsibility perspective. We need to not be short-sighted in looking at these issues and recognize that the funding we spend on mental health saves us money down the line, and these cuts will cost us more. Thank you.
Thank you, Delegate, and we very much agree that we should be leading with our values and thinking about this in a fiscally responsible way. Thank you for that. We're going to start with 988 and the importance of restoring the funding for the 988 helpline. And I have 2 speakers that'll be coming up in a second. But I just want to highlight again, 988 has been around for roughly 2 years, and in Maryland, 988 calls have increased 130% since July 2022, and that's when the line launched. We've also seen text messages to the helpline increase 20-fold. So this is a valuable universal resource that our community is using, and we need to restore the $25 million in the FY26 budget for the helplines to support Maryland's 8 existing 988 call centers. Without action from the General Assembly, the 988 counselors will need to be laid off. As I mentioned earlier, wait times will increase, and Maryland has one of the best wait times in the country. We pick up the phone fast. So here to help kind of hit that message home and tell you more detail, I had Michelle Grigsby Hackett, the Chief Executive Officer from Affiliated Sante Group, one of the 988 helplines in Maryland.
Good afternoon, everyone. We're here today because Maryland's mental health crisis is real, and the need for resources like 988 Suicide and Crisis Lifeline has never been greater. As Adrian indicated, more Marylanders are using 988 and reaching out more than ever before. Just in December alone, over 8,000 calls were answered. That is a 30% increase from last year and a 130% increase since the start of 988. And as Adrian said, text messages have increased twofold in 2 years and 20 times higher since we started. So we're facing significant gaps in funding in the governor's budget. With those gaps, we won't be able to support the 988 call center operations. And without sufficient funding, we won't be able to continue to answer the call. Through the 988 funding, Sante alone has hired 30 call center staff. Additionally, the regional call center that is run by BCRI, Sante, and Grassroots are able to answer 90% of our calls in less than 20 seconds with over 60 staff. If funding from 988 Telecom is not allocated to the 988 Trust Fund, we will have significant impacts. The calls will go unanswered or have significant delays being answered. We will lose staffing, critical, highly trained crisis counselors. Emergency departments that already have high wait times in the nation will continue to be overwhelmed, and Marylanders will begin turning to 911 to get help for their mental health crisis. We have to ensure that the governor allocates the proper funding to support 988 call centers. In addition to 988 funding, we also have to protect the crisis grant funding. This was mandated through legislation in 2019. Through this funding, we've been able to expand mobile crisis services, urgent care walk-in centers, and crisis stabilization services, while improving youth crisis care across Maryland. Sante, being only one of the grant recipients, has been able to serve over 10,000 individuals in 8 counties through this funding. The proposed cuts would be devastating. Counties like Carroll would end up losing mobile crisis services permanently, forcing individuals to hospitals and to engage with law enforcement. This is not an issue we can afford when we have effective community-based services available. The governor must allocate $5 million in crisis grant funding that is not currently outlined in the FY26 budget, and lawmakers must pass Senate Bill 599 and House Bill 1049 to continue the funding through FY29. Investments like 988 and crisis grant funding save lives and must be restored. Thank you for your time, and I'd like to turn it over to Gus Hughes.
Hello, my name is Octavius. I go by Gus, and I myself have used the 988 line for quite a long time. So in my own experience, in last year of 2024, it's no longer 2024, I almost said 2023. In 2024 was the last time I used it. It was May of last year. At the time, I was homeless in a motel, and I was stuck in a cycle where there were no homeless shelters that were able to get me in, or my roommate. I had a lack of access to medication. I had a lack of access to healthcare. I lost my therapist, psychiatrist, my primary care doctor back to back to back. I lost all my resources, and the tipping point for me was being at that motel, going out on a walk to clear my head, and nearly being sexually assaulted. This was a repeat experience that shouldn't have happened. It could have been avoided, but it happened, and I had no resources. Again, I had lost my psychiatrist, I had lost my therapist, I lost my primary care. I couldn't get my meds refilled, I couldn't see my therapist. And because of that, I ended up turning to 988, and that genuinely saved my life. The counselor picked up within a minute. I was able to access a resource in line specifically for LGBTQ youth. And without that counselor being there to talk me out of the crisis I was in, and also forward resources that were local to me to help me find shelter, to find a therapist, and even just general resources that I could use and utilize, I probably wouldn't be here. On top of this, I know multiple people who have used 988, and it has significantly helped their lives. If we lose this line, similar to what other speakers have now said, people are going to be redirected to law enforcement. People are going to be redirected to hospitals. Firemen might have to come if 911 is called. And this is resources that could be used otherwise when we already have a resource that we have here. And on top of this, right now, people are on the threat of losing their, Medicare and Medicaid and medications. I myself, I haven't had my ADHD meds in over 3 months because my insurance stopped covering it. And now with the executive order 14212, my insurance won't cover it completely. I'm reliant on these stimulants for, sleep cycle, being able to focus for work, and even just general daily functioning and living. I have no other options in terms of medication now because all of them, affect my blood pressure, and I already have low blood pressure issues, and I can't do that anymore. I'm not cleared medically. More people are going to lose their medication, and more people are going to be in a state of crisis, and taking away this resource is going to exponentially make that situation worse, and nobody should have to deal with that. So I ask all delegates and senators to please keep this funding. It is important, and we can make an impact on keeping people safe and keeping people alive. Thank you.
Thank you, Gus. 988 really is a life-saving tool. We have been joined by Senator Letterman. Yeah, so I'd like to invite her up to the stage.
Thank you so much. Thank you. The Senate went late, so we are doing the people's business there, and I'm very pleased to join you today. And I just want to say thank you, Gus, for sharing your experience. It really brings home the real life impact that cuts to mental health services have and why it is so important. Every data point that we are getting from professionals out there in the field and from surveys indicates that young people especially and the larger community are still suffering from and continues to grow from needing mental health services. It is a trying time too, and so I think that we will find that the need is going to increase. I happened to walk in, I think, at an opportune time where folks were talking about services in Baltimore County with Affiliated Sante, which gets a behavioral health response grant to enable for the provision of urgent care services for 12 hours each day, 7 days a week. And we know that services like this are able to address the needs of people in crisis situations and are able to provide those many needed services that would otherwise go to our emergency rooms. I don't need to tell folks in this room how overburdened our emergency rooms are. We have the longest emergency room wait times in the entire nation, unfortunately. And so when we can provide crisis services and walk-in clinics and in-school crisis intervention services, which these behavioral response grants provide, we are diverting services to programs that can provide the direct services and not to the already overburdened services that exist. This is smart, this is saving money, and that is why I was at right before the deadline, when Daniel came into my office and Adrian came into my office and they said, would you put in this bill? I said yes. It is, the bill continues this grant program that has been in effect since 2018, and it ensures that $5 million each year is provided so that our local counties can continue to provide the much-needed emergency services. So this is, these are tough budget times. There's just no question about it. And we have to make some really difficult decisions, and this is compounded by what's happening down the street in Washington, D.C. And I know that my colleagues and the governor, we are all going to work in good faith to address the needs of the most vulnerable among us, and that's what these services do. And so I will do all I can to ensure that they continue. And I thank everybody up here for your advocacy and for your willingness to bare your souls and to talk about the really, really important work that is being done in each of these programs. Thank you. Not anymore. Thank you, Senator Middleman, for your leadership, and both of you for the hard decisions we know you need to make ahead. Thank you.
I also want to just take a moment to acknowledge that the point Senator Heddleman made, which is behavioral health crisis services do save money for our larger healthcare system. And this issue of fully funding the 988 helpline and funding behavioral health crisis services is so important that all of the behavioral health crisis service providers are standing behind me right now. Every one of them in the state is back here. That is how important this issue is. So I'm going to shift and move to school mental health funding, which is another area where there are cuts in the FY26 budget. As I mentioned earlier, over the past decade, we have worked hard to make sure mental health care is accessible for children, families, and individuals. But now all of this progress is at risk. The state budget contains $90 million in cuts to mental health, cuts that would especially harm our children and youth and students who need mental health services now more than ever. So unless we act now, mental health services will be drastically cut at every level, from screening to early intervention to services and counseling services available in school. So here to shed some more light on the policy issue and what this means locally is Dan Martin, the Senior Director of Public Policy at the Mental Health Association, and Nikki Highsmith-Baranick, President and CEO of the Horizon Foundation.
Adrian, thank you all for being here. Like Adrian said, I'm Dan Martin with the Mental Health Association of Maryland, here to talk about the cuts to school mental health. Data from Maryland, just recent data from Maryland shows that 36% of Maryland high school students are persistently sad or hopeless. And as Adrian said before, 1 in 5 high school students and 1 in 4 middle school students have seriously considered suicide within the past year, with 10% of both high school and middle school students having actually attempted suicide within the past year. And despite these dire statistics, the FY26 proposed budget would reduce the annual budget for the Consortium on Coordinated Community Supports, which provides mental health funding to public schools in every single jurisdiction across the state, by $90 million per year. That's not just this year, that's every single year, from $130 million to $40 million. That's a 70% cut annually for school mental health services. So the General Assembly made a historic commitment and investment in the mental health and well-being of Maryland youth when they included this consortium funding as part of the blueprint for Maryland's future's public education reform effort. And after several delays, the consortium just became operational last year, but it is already having a really tremendous impact in just its first 6 months. The consortium provided mental health resources to more than 58,000 students across 80% of all of Maryland public schools. It increased Maryland's school mental health workforce by nearly 500 individuals. It provided mental health training to nearly 1,200 school personnel, and it improved mental health outcomes for 70 to 80% of the students that were benefiting from the funding. And so this cut would be devastating to the schools and the jurisdictions across the state that worked so hard to just get these programs up and running just last year, and even more devastating to the students that are benefiting from the services. So we're asking the General Assembly to reject the proposed cuts to the Consortium on Coordinated Community Supports and make sure that Maryland school children have the resources resources they need to thrive and succeed. And with that, I'm going to turn it over to a partner, Nikki Highsmith, who is running one of the hubs that's providing these services.
Good afternoon, everyone. Again, I am Nikki Highsmith-Vernick, and I'm President and CEO of the Horizon Foundation. We are Howard County's Community Health Foundation, and we're the largest independent health philanthropy in Maryland. And I particularly want to thank Delegate Feldmark for being here today. We are a proud participant in the Howard County Community Supports Partnership Hub, again, one of 12 across the state set up through the consortium. As by design, each of these look different around the state, but they all provide an opportunity to deliver comprehensive behavioral health student services for students and to be the central point of coordination between schools, providers, and families. We cannot overstate how critical this program is to addressing the growing mental health needs of children and youth in our community and across the state. Some data from Howard County. Again, you've heard a lot of data today. We're going to drill it in. 30% of middle schoolers report feeling sad or hopeless. Our Black and Latino girls and our LGBTQIA plus children and youth experience the highest rates of mental health challenges, including depression and suicide ideation. We need kids to feel better so they can learn. Without the funding that was promised for the consortium, these problems will only get worse. Cutting services now means children and families and students will suffer. Mental health is a critical component to student success, inside and outside of the classroom. Without improving the mental health of our youth, we will not meet the goals of the Blueprint for Student Achievement. As was said earlier today, we're taking money that's actually going to cost us money. So we must continue our work to increase access. In our community, we've created increased culturally diverse and affirming providers. We've provided more peer support for youth and parents, and we've expanded substance use prevention and intervention. All of these services are at risk. So this is a time to lean in, provide more support to our most vulnerable populations, as was said by the Senator, not less. Thank you.
Adrian. Okay. You're gonna be sick of me by the time it starts. No, thank you, Nikki, and I think she really hit the point home around how important it is for students to have positive, good mental health so that they can learn. We worked really hard to make sure that these services were available in school, and now is not the time to take them away. I'm going to shift us to the last part of the agenda, which is talking about restoring funding for certified community behavioral health clinics. The FY26 budget proposes to abandon the state's efforts to expand Maryland's network of federally designated certified community behavioral health clinics, which provide a comprehensive range of urgently needed outpatient mental health care services and substance use services for people in their communities. Existing CCBHCs would lose their funding if we do not act now. So here to shed some more light on this issue is Shannon Hall, Executive Director of the Community Behavioral Health Association, and Carrie Guthrie, President and CEO of Cornerstone Montgomery.
Thank you, Adrian. I'm Shannon Hall, Executive Director of the Community Behavioral Health Association of Maryland. We represent 97 community-based mental health and addiction treatment providers across the state, including many of the folks behind me today. I'm here, I'm not following Adrian's instructions explicitly, to talk about two things, the CCBHCs, but also Governor Moore proposed a 1% increase for behavioral health providers. And some of the budget analysts have suggested removing the 1% rate increase to help address some of Maryland's other priorities. We're urging our colleagues in the Senate and the House to support Governor Moore's 1% to restore the CCBHC planning. And let me tell you why. In the fall, the Maryland Healthcare Commission released a report looking at Maryland's behavioral health workforce. They talked about the rising demand that you've heard about today, and said that Maryland today has half the behavioral health workforce it needs to address the current needs of Maryland residents. And many of those workforce are going to leave in the coming years unless we do things differently. That report said the number one thing that Maryland needs to do differently is increase salaries for frontline behavioral health workers. This is not the first report this year that has called for strengthening Maryland's community behavioral health services. Just last spring, the General Assembly convened a work group to look at hospital throughput barriers in the state of Maryland. Do you know what their number one recommendation was? Their top priority was creating and strengthening sustainable community behavioral health programs. And that's not the only one. Our Healthcare Commission's state plan also calls on legislators in the state to strengthen community behavioral health funding, because we all know that this strengthening will help alleviate the problems in our hospitals, alleviate the problems in our school. So we're asking to keep Governor Moore's proposed 1%. It's also critical, this $1 million cut, it's not technically a cut. The federal government has already awarded Maryland almost $1 million to engage in long-term planning to strengthen its behavioral health services. And the Department of Health has said, no, we don't need the money. We're leaving it on the table. We're leaving the planning opportunity and the funding on the table. We are not going to pursue CCBHC planning. So we're asking our legislators restore the obligation to take the planning dollars and come up with a plan that comprehensively addresses Maryland's behavioral health needs, that CCBHC funding model. A lot of the fiscal obligations kick in FY27, so we have plenty of time to figure out our return on investment on this. So this is a federal dollars to strengthen Maryland's certified community behavioral health clinic model. And I'm going to invite Carrie Guthrie from Cornerstone up here to tell you a little bit more about the work that they've been able to achieve for their community with the federal grant funds to develop this capacity. Thank you.
Good afternoon, everyone. I'm Carrie Guthrie, and I am the president and CEO of Cornerstone. We're one of the largest behavioral health providers. We provide services in Montgomery, Charles, Calvert, and St. Mary's counties. We were one of the first two original organizations in Maryland to receive a CCBHC SAMHSA expansion grant. And in fact, we've successfully received 3 of those grants, so that over the last 6 years and for another year and a half, we've been able to position ourselves to be a key partner with the state of Maryland in the implementation of CCBHCs. So there's at least 5 of us in the state already. We're here. We want to work with the state. We want to help them make this happen. We use the grants for one-time expenses, but we also use them for startup funds for new services and data and technology. One of the big things about CCBHCs is access to care. So we purchased translation technology, which allowed us to expand our translation services from 904 minutes to over 15,000 minutes in 21 different languages to make it easier for people to access our services. We also added certified nursing assistants and licensed professional nurses, licensed practical nurses, to help over 200 clients who are aging in place. So many of our clients have co-occurring medical issues. You've probably heard the statistic that people with mental illness die 25 years earlier than the rest of us for the same reasons, for the obesity, heart issues, blood pressure, diabetes, but they don't have the resources to go to the doctor, listen to what the doctor has to say, and do what the doctor suggests for them to do. But as a result of our putting in place the CNAs who can actually help clients with personal hygiene, with their medications, with what they should be eating, with purchasing food, and the LPN to coordinate care with the doctors, we saw a reduction of 36% in hospital admissions and 59% in ED usage. Maryland being the best place in the country, or the worst, I guess, to go to an emergency department, if we can reduce things like that with CCBHCs, think of the impact that'll have on the entire population. That means people who go to the EDs, who are going there for legitimate needs, will be able to get the support they need, and people who don't need to go to the ED can get their services in the community in a more appropriate setting. It's important to note that the services I just talked about, the translation stuff and that health stuff with the CNAs, are not reimbursable under our current Medicaid fee-for-service model. We are able to do those because of the CCBHC funding. So we would need to sustain that funding or get authorization to bill for these services under Medicaid, which probably isn't going to happen. We risk a severe shortage, and we're going to have to cut some of these services. So that means, as we've heard from multiple people, Where are the alternatives? The alternatives are that those clients are gonna go back to the emergency rooms, go back into the hospital, get involved with the jail system, or end up homeless. So this is a crisis, not just of crisis funding, but also of the CCBHC funding that should be expanded and implemented in the state. And they've fundamentally changed behavioral health across the country, giving organizations flexibility, evidence-based practice, and financial stability. That's one of the key components of CCBHCs. We need the legislators to restore that language, to restore that what obligates the Department of Health to pursue this planning grant, that $1 million that Shannon mentioned. And as for the 1% Medicaid increase, I'll just, rates do need to keep pace with inflation and higher cost of living, which they obviously have not. We continue to struggle to pay staff a living wage. Most of our employees cannot afford to live where they work, particularly in Montgomery County. They need multiple roommates or they're still living with their parents. We struggle to compete with programs in DC and Virginia who do pay more. And we haven't been able to consistently give staff raises each year. We haven't. It hasn't happened, not consistently. And that is something that I have to say is incredibly frustrating as the CEO, because I know how hard our staff are working and how committed they are to the people that we serve. So we don't want to return to what we had, 10 years ago, where we received only, I think, 5 increases in 20 years for Medicaid rate increases. I mean, it was something absurd like that. This needs to be a priority every year, and we need that 1% rate increase to remain in the budget. Thank you.
Thank you. So we're here, we're calling on the General Assembly. Work with Delegate Feldmark and Senator Hebden to make sure that there's someone there to answer the call when someone calls 988. We're calling on the General Assembly to restore the $90 million in cuts so that there are services available for our kids in schools at a time when they need it the most. And we're asking for them to keep the doors open for our outpatient mental health clinics that have been able to expand their services. We're calling on the General Assembly to act. Restore this $116 million in cuts. At this time, we'll take some questions.
Just a quick clarification on the cut itself. Is this 116, is that general funds or is that federal funds as well?
This is all general funds. Yep.
Is any of that planned increases, or is it all based off of the current funding model?
So we have multiple people to answer this question. So I'll start with 988. This is funding that we have been expecting to receive. And last year, the General Assembly, under leadership with Delegate Feldmark, do you want to answer this question? Yeah, she passed a bill last year to establish a telecom fee.
So last year's legislation established dedicated revenue for 988. And based on those revenue projections, we anticipate this funding being available for 988, but it is not appropriated in the budget. So if it's not appropriated, even if the revenue comes in, we can't spend it. So, we want to make sure that we are utilizing the decision we already made to use that fee for this critical service.
So it's not even been implemented yet, and it's already being changed by this point.
It has been implemented, but the revenue that we are expecting is not continuing in the budget that's proposed for next year.
Yeah, so the revenue is being collected, the tax is being collected now. It started in October. It's like the delegate said, the General Assembly needs to allocate the money in the budget so that the department has the money to spend it and give it to our existing 988 call centers who have been around for decades. For the consortium, the $90 million in cuts, that came out of Maryland's blueprint, and I'm going to turn it to Dan to shed more light on that.
Yeah, real quickly, the legislature, the law requires $130 million a year for school mental health services provided to the consortium on coordinated community supports. The budget as introduced this year would amend that language and change it to $40 million a year for this year and every year hereafter. So it's a $90 million annual cut, 70% annual cut for existing school mental health funding.
Any other questions? Oh, yeah, thanks. And that is federal funding, yes?
That Yes, that's federal, this is federal funding, the $1 million. It's not state general funds. So that, it's actually $925,000 and some change. Again, money already awarded. The feds are actually trying to give Maryland money in this instance, and Maryland's saying, nope, never mind, don't want it, don't need a behavioral health plan. So we want to keep that obligation to do the planning, take the funds, and work on the FY27 appropriation. Yeah.
So, are you saying that the state had applied for this fund and then is not taking
Yeah.
it up?
The General Assembly passed a package of behavioral health bills back in 2023. Senator Ferguson, bipartisan support, calling on the state because so many sectors of healthcare really need a well-functioning community-based behavioral health system. So the General Assembly responded to this call, passed a package of bills, including an obligation for the Maryland Department of Health to apply for the CCBHC planning grant, and then apply for the Medicaid demonstration program. The state did apply for the planning grant in August or September. We've got about 6 CCBHCs in the state. The planning grant indicated that they were, at that time, beginning to plan for having 10 CCBHCs. On January 3rd, the federal government announced that Maryland had been awarded the CCBHC planning grant. And then shortly after that, the governor's proposed BRFA came out, where they both deleted the obligation to pursue the FY27 demonstration program, but also deleted the obligation to accept and pursue the CCBHC planning that's already been awarded.
Thank you. And just to clarify my earlier comment, yes, this is all general funds except for the 1 million for CCBHCs. And I'm realizing we didn't address the question, the crisis services grant. This is $5 million that's been in the budget in previous years to fund crisis services throughout the state. We are calling for the governor to put, this is cut, it's $5 million in cut in general funds. We're calling for the governor to put that back in the budget, and we're grateful for Senator Hedlund for her leadership of that bill in the Senate.
For the senator and delegate, we were in this room on Friday. The Senate President said they're looking at, or actually Senator Gazzoni said, they're looking at $200 to $500 million in more cuts to the current budget. How realistic do you think this plan is to get $116 million put back in?
Look, it's a challenge, and the reality is we don't know what is coming. You read in the newspaper what I read in the newspaper, and maybe we will know something more this week. I know that the House has before it, I believe, a reconciliation bill. March 14th seems to be the red letter day, which we will know if we have more, if our government will continue to be funded, and we are. The one thing we have to do here is pass a balanced budget before we adjourn after 90 days. And so these are really difficult decisions. We are going to use the information that we have at the time that we have it, and we're going to do the best job we can. So there are a lot of unknowns right now, but we can only deal with what we do know and do the best we can. It's a challenge all the way around. I mean, there are these cuts, there are other cuts that I know that we are very interested in restoring, and at the same time, we have to make sure that we're providing the services that Marylanders expect and need, and certainly prioritize those that are most vulnerable among us.
I guess I would just add, I don't think anyone, the governor or anyone in the administration takes these, these cuts or any of the difficult decisions that were made in the proposed budget. I don't think they take them lightly, right? But we do need to work together to make some very tough decisions. And as part of that decision-making process, I think we need to realize not only the importance of these services, but also the future costs associated with these cuts. And I think that's, that's the difficult conversation we have to have.
We've got time for maybe one more question. Yes.
Chris with WBAL. Have there been any conversations with the governor's office? I know he's talked about the North Star being, our youth and being able to work and have earned wages, but that's certainly, mental health is the priority so people can go to work effectively. I would feel like he would maybe be receptive to these conversations. Have they happened and any progress there?
Yeah, many of the advocates here have had conversations with the governor's office to make sure they're aware of these cuts. I think they're looking at everything in totality, and I just want to echo what our leader said, is that they know what they know today, and they do have some tough decisions they need to make. All right, if there aren't any other questions, because that was a quick one, if there's no more, then thank you for joining us today. And we'll hang around if there are other questions.